Welcome back to the IndeVets Happy Hour. I'm here with my co-host, Dr. Marisa Brunetti, and I am your host, Dr. Andrew Heller. That's DVM and VMD, or reverse that.
Thanks for having me here, Andrew,
in your own home, as usual.
Again.
And thanks for supplying the beer. I will say I'm having a really delicious one. It's a Trogs beer. It's called Sunshine Pilsner. Delicious. Thank you.
Trogs is awesome. They make Mad Elf, which is my favorite winter beer. 10%er. Definitely worth it. One will get you there.
Yeah, and our producer actually just handed me another beer. It's another Northern German style Pilsner called Pikeland Pils by Sly Fox. So excited to try that one too. What are you having?
Nothing local.
Nothing local. All right.
Not today.
It looks red and in a nice wine glass.
Yes.
Well, let's get to it then. We are in our final episode of our summer series, our Hot Pet Summer Series, as you coined it.
It's a hot pet summer, so you know she got it lit.
And what are we talking about today?
So this is a conglomeration of something everyone is probably going to experience at some point if you have a dog, especially in the warmer months. So we're going to go over some first aid associated with things that may happen to your dog outside. So bite wounds from other dogs, lacerations. We're also going to talk about how you can address certain wound care while you're maybe out in the middle of the woods somewhere, and when you need to go to your vet. So I think this podcast is mostly aimed at pet owners, but we really want to educate pet owners so veterinary professionals can see their pets in a timely manner, and that they don't do certain things prior to getting to their vet. So you're welcome, veterinarians, for highly educating the pet owners before they get to you.
Yeah, I mean, we can all, ruminate on very many stories of people bringing in their pets with very odd bandages, too
and
tight.
Wounds that were 3 weeks old, and yes.
Yeah, it's crazy. So maybe we'll set everybody straight in this episode. So you mentioned, actually, that you keep a first aid kit for your pets at home. And I know you have access to certain things that not every pet owner has. So let's talk about some things that you have in your first aid kit that you can get as a non-vet, and then talk about some things that maybe veterinarians could keep in addition.
So I do keep a first aid kit in my home and in my car, actually. And when I take my dog on hikes, she gets to carry her own first aid kit in her little backpack.
Really?
Yeah.
That's so cute.
That she wears. So I don't have to put extra weight on my back. But a couple things that are in the kit that I just get at CVS, that you can get at CVS or any other pharmacy or grocery store, is cast padding. Yeah. So that's just like the absorbent layer of a bandage.
It's cotton.
Cotton padding. Yeah. Tape. So white medical tape.
Yeah.
An ACE bandage is actually something super easy to buy that is rolled up very easily and you can apply very easily. So I carry one of those. And then 2 small little bottles of liquid. One is a saline, just a pure saline flush. Like you can get that in the contact lens aisle. And so I keep one of those for flushing out dirt or wounds or eyeballs. Honestly, if your dog is running through brush and gets something gross in their eye, you can flush it out with saline. Then
it's probably found in the eye care center, like under eye wash.
Yes.
Just sterile saline.
Sterile saline, yep. In a travel size. And then I like a Chlorohex scrub. If you're a vet, you can make your own at work and then put it in a small bottle. But for owners, what I tell owners to get over the counter is a brand called HibaCleanse. And my pharmacist parents always taught me about HibaCleanse. We always had that. So that is actually Chlorohex scrub, so antibacterial flush and scrub that you can use. Other than that, I always recommend triple antibiotic ointment, so something like Neosporin, and I always carry some Benadryl with me as well. I know we talked about this, like Benadryl is something easy that you can get over the counter. You want to make sure that it's just plain Benadryl. Children's Benadryl also works for small pets.
Yeah.
And for pet owners out there, Benadryl is pretty easy to dose. You will notice the dose is much higher for dogs than it is for humans, so don't be scared.
Yeah.
But for pets, it's 1 milligram per pound of pet. So my dog is 50 pounds, so she gets 50 milligrams. And normal Benadryl tabs are 25. So she gets 2 tablets as her dose.
Yeah. So you could probably get away with using the pills even for the small breeds.
Like you
cutting
can use
it in half.
Yeah.
And if you're a little over on that, it's safe. It's a very safe drug. If you can't give it, there is an injectable form that when you bring your pet to the vet, we can inject it.
So Andrew, what are some of the things, why would you need Benadryl when you're out and about?
The number one thing I think of is like a bee sting or some kind of insect bite. that causes inflammation and swelling.
Yep.
Many of us as vets obviously know this, but for those of you out there, if you've ever seen your animal get stung on the snout, on the nose, it'll blow up and get really, really swollen. And, sometimes just giving them some Benadryl, diphenhydramine, does the trick. Other times, if it's a little bit more severe, you may need to go into the vet's office and get a steroid injection.
And tell our pet owners out there, what makes it severe enough to seek care?
I think if they are having difficulty breathing, that's number one. Number two, if they're really uncomfortable and the Benadryl isn't doing the trick and they're really pawing at their face or pawing at a particular area of the body where they were stung, it's a little bit of a judgment call. You can also try icing as well to bring down some of the inflammation. Certainly something that everybody has at home.
And if you do see a stinger, so say it's a wasp or some other stinging animal, even if you don't have like tweezers or something, if you're out in the field somewhere, you can use like a credit card or some other hard object to kind of scrape out the stinger to get that out, because sometimes that's what's bothering the pet. So it's something you can just use that you have on hand.
Yeah.
Don't forget to bring your credit cards on all hands.
Oh, never leave home without it.
Or your license, to get your driver's license.
Yeah, so I think that stings are the main reason to carry the diphenhydramine, the Benadryl. Other things you might encounter, other injuries you may encounter outside in the summer, orthopedic injuries. Much more common in the summertime than in the wintertime. So I think the first thing you'd notice with an orthopedic injury is obviously lameness.
Right. And a couple things before that. Your dog is not instantaneously in shape, right? So think about you not being in shape over the winter, and you have to kind of start slow. So if you've been running a lot, but your dog hasn't, even hiking long distances, like you have to start slow. And go back and listen to our first Hot Pet Summer episode about heat stroke, because that's also very important. How long you go and how hot is it?
By the way, since we did that episode, I watch my dog so much more outside. I looked
He's a
at
veterinarian.
Her. Yeah, but I mean, I just didn't think about it as much until we started talking about it. And I'm like, I really need to be careful with the heat.
Yeah, and interestingly enough, I was visiting one of our doctors in Virginia, and she was working ER, and unfortunately, she had a horrible heat stroke case, and the dog did end up dying from kidney failure.
Jeez.
So
yeah, we talked
about
that.
So it is real. So yes, be prepared for exercise, especially in the heat, and especially if your dog is quote out of shape.
Or we could just say it, overweight, fat.
Yes, especially, yes.
We should do a whole podcast on how to know if your dog is fat or not.
Absolutely. I'm going to guess that the majority of dogs are fat, because the majority of dogs we see are unfortunately overweight.
I keep a very close eye on my dog. I'm always feeling her ribs.
Your dog just has a really good metabolism, so you're not really...
No, I really starve her. I mean, she's a hound. She would eat and eat and eat until the bag is done. So
that's true. That's probably why she dug under your fence to get out. She was searching for food.
Oh yeah. I always see her eating things in the fields.
Anyway, so let's talk about how you can tell that your dog is in pain.
Yes. Well, I mean, I think lameness, right? Everybody knows lameness means they are going to be limping or lifting a leg, not putting pressure on it, licking it, potentially not running around.
Right. And it can also be really subtle if you look at your dog and they're like shifting their weight to one side, and you're like, why are you tilting, right? And that's just to kind of take the pressure off the other leg.
So there are definitely different degrees of sprains and strains. You can partially tear a ligament. You can completely tear a ligament. You can, and partially we call it a sprain.
Right.
A torn ligament is going to require surgery. So there are different degrees of these injuries, but things you can do.
So as we were discussing, the most common soft tissue injuries that we see are strains or sprains, soft tissue injuries, right? That don't require surgery. And so the first thing you want to do is acknowledge that your dog is painful somewhere. Some people will feel every joint in the limb, which I think is important. Sometimes you can feel heat in certain areas. Sometimes you can feel swelling. Sometimes your dog will turn around and look at you real quick if you squeeze an area that's upsetting. And the first thing is rest your dog. So if it's the middle of the night or it's the weekend and you can't get to your vet, you want to rest them.
What's your rule of thumb for time for resting?
This is a tough question because if my dog was limping for 24 hours and nothing changed with rest, I would take her in. So I'm much more conservative probably than you would be.
No, I was going to say I usually tell people rest at least a week.
Yeah.
because if you don't, it's not going to heal properly and it's just going to keep happening.
Well, okay, I think we're talking about two different things. I'm saying like I will rest my dog for 24 hours, and if she's not improved, then I will take her in and I will get her medication, and then I will rest her with the medication, because I know we're both big pain management proponents.
Yeah.
And so I would tell people it's okay if you can't get to a vet to rest, confine your dog, crate rest your dog for 24 hours, keep them off the limb, and see if they twerked it a little bit, they're going to get right back up, in around 24 hours. If they don't, we really recommend you get to your vet as soon as possible, because that's how dogs show pain. They limp, and you can assume that your dog is in pain if they're limping.
Yeah.
So what shouldn't you give your dog at home if they are limping?
Anything, right? I mean, do not give them any drugs unless the veterinarian has told you to. Just trust us. Don't self-medicate. Other things we see people abuse is like baby aspirin.
Or aspirin at all.
Aspirin at all. Do not give your pet. We have much better drugs now, and they're too dangerous to give,
with other NSAIDs especially. So the reason we say this is, yes, is aspirin safe technically, quote, quote, for dogs? Yeah, it is. But using aspirin and then going to your vet when your vet wants to give your dog a better anti-inflammatory can really be a problem.
The side effects from aspirin could include a lot of stomach issues.
Ulcerations,
things like that. So we don't use it typically unless we're giving it in small doses for blood issues in pets. We really now only use other NSAIDs designed for dogs. So just check with your doctor before you do anything. Another thing, don't give your pets human NSAIDs.
Correct.
We've seen pets have real issues from being administered ibuprofen, for instance.
Yep.
And it's just not a safe drug. The dose range is really tight.
Yeah. Obviously, if your dog is limping after 24 hours of rest, and even if you've iced the area that you think is bothering the dog, we do recommend that you get in and see your veterinarian. And some things that your vet is going to check when you bring your dog in is they're going to do a full orthopedic exam. They'll probably lie your dog down on his side, do a full range of motion of every joint, trying to localize the pain, because obviously it can be tough for us because we don't know and your dog can't talk. And so hopefully we localize an area. We are going to check for one of the most common surgical injuries, which is a tear of what we call the ACL in humans, but we call in dogs the CCL, which is the cranial cruciate ligament. And so there are some manipulation tests that your vet will do to try to see if that ligament has been torn.
We also rely on radiographs to make sure, even if it looks like there is that complete tear, we still want to radiograph the area, make sure that there's not a fracture in addition.
Right.
I know many surgeons that, they get referrals for, what they think are cruciate ligament tears, and they go and do the radiographs and there's actually a fracture.
Yep.
And so we really want to make sure to radiograph.
And for vets out there, don't forget your pain meds and your sedatives for doing orthopedic radiographs.
There are other orthopedic issues that can happen out there, like dislocations. Mm-hmm. Again, just bring them right into the vet for those types of things.
Absolutely.
Oftentimes,
if you see a bone
outside
of the skin,
rush.
Please bring your dog directly.
Don't let that sit.
Do not pass go.
All right, so let's get into the more fun stuff.
Oh, really? Are bite wounds fun?
Yeah. No. I mean,
they may be fun for us to repair.
Exactly. But we all know in the last year there have been more pet adoptions than ever. There are a lot more dogs out there, a lot more people at home walking their dogs. And let's just say it, they're not all trained. I think bites are becoming more frequent. They might look like little punctures and you think, oh, it's no big deal. But that's really not the end of it. Sometimes it's just the beginning.
Yes.
And bite wounds should really be seen to.
Yep.
Usually when a dog bites, it pulls the skin away from the underlying subcutaneous tissues. And that can create this dead space where bacteria can fester and it can become abscessed. And so we certainly want to address the bite wound in the vet's hospital with flushing, antiseptic like chlorhexidine, oftentimes requiring some suture or even a drain placement.
Drains, yes, owners. So I've had dogs that have eaten their own drains out, which is difficult because if you think about it, a drain is going to be exiting the skin of your dog. And so if the dog chews off that part, there's still another part inside the wound.
Well, let's just discuss what a drain is. So a drain is a little piece of rubber. It's a sterile piece of rubber that you put inside the wound, and you cut a little hole in the skin. Obviously, the animal is going to be anesthetized during this process, but you have the drain, the rubber, inside the wound and exiting out at this incisional site. And what it does is it allows any bacteria or fluid that's being produced to exit the wound and allow it to heal. And usually after a few days, you can pull it out.
No more than 5 days. So if you are a pet owner and you're like, what's another couple days? I can't get to the vet. No, you need to come back when your doctor tells you to come back and have that drain removed.
Yeah, and even if it's still producing some fluid, it will never stop producing fluid as long as it's in there. So it doesn't mean that it hasn't worked. It just means that the body's actually reacting normally to it.
Right.
So drains are something for you to just be aware of, that you may need something like that.
Especially if the wound looks small, be prepared for your veterinarian to tell you that there could be a pocket in there. And once there is a drain, like I said, your dog should have an e-collar or some other way to not get to the drain, because if they eat it, there's lots of other issues that could come about.
What about antibiotics for bite wounds?
Controversial topic, of course. Antibiotics is always controversial, but more than likely your doctor will prescribe an antibiotic for bite wounds, as well as an anti-inflammatory and maybe a pain medication, depending.
Especially for a cat bite. If your dog is bitten by a cat, you definitely want to get on antibiotics right away. If it's a superficial bite, you may not need antibiotics. I would say if it's deeper and if it's been several hours since it's been flushed out, you're probably going to need to get the dog on antibiotics. So let's talk about lacerations now, which is similar to a bite wound, but it's slightly different because it's usually cleaner.
Lacerations come in all shapes and sizes, and so they can be scary.
They're always shaped as whippets.
Yes. Dogs with thin skin, like my dog,
yes.
And little hair, really have a problem with lacerations. And so lacerations from, once again, you're out hiking, your dog's running through the brush, it can be incredibly common for them to get some lacerations. And so obviously, a laceration is really just a break in the skin barrier. And just
there's obviously varying degrees of this as well.
Yes. It could be down to the muscle. It could be down to the bone, God forbid. It could be very superficial and just be the skin.
Or through a major artery.
Ooh, okay.
Which we won't go into.
True. But I think this is a good time, to bring back that first aid that we talked about in the beginning of the episode, which you can really do a great job of helping your dog with these lacerations before you can get them to the vet. So, number one thing with lacerations, with any bleeding of any kind, Andrew.
Pressure,
right? That's probably the first thing we learn in vet school, right? Put pressure on a wound.
Can we insert a song, Under Pressure?
Under pressure. Dun, 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 dun.
I don't know if we can. Copyright.
So anyway, yes, pressure first and foremost if there's bleeding. And bring out that first aid kit. And if you need to, you can always use saline to flush away any debris, obviously, that is going to be in there because it is a wound that your dog probably got running through some brush or, hitting themselves on a tree. And so flush that out and then use your cotton and your ace bandage.
Well, first, use your nonstick gauze. If you have some nonstick gauze pads, put that on the laceration first and then wrap it in the cotton padding. And you could also apply some triple antibiotic to it to keep it clean and to prevent bacterial growth.
Yep. Until you get to a vet.
Yes.
So we are by no means saying that this in the field MASH unit style treatment of your pet's laceration is the end all be all. This is to keep the wound clean and hopefully stop the bleeding until you can get to a veterinarian. And we recommend wherever you go, knowing where your closest emergency veterinarian is. I cannot stress that enough. I find that when people need an ER for their pet, they just don't know where it is.
Yeah.
So that's another thing.
Yeah, and I'd say most lacerations will require some stitches of some kind, so your vet's going to need to be there for that.
So put some pressure on, wrap it up, get to the vet, try to keep your dog as immobile as possible if you can until you get there, just to and try to keep them away from the wound itself.
So in the summertime, hit by car accidents happen a lot more frequently. That's obviously a really big emergency. You need to get them right to the vet. But I would say use all the similar techniques we talked about in terms of pressure for bleeding. Don't give medications, again, no matter how bad you think it is, without talking to a doctor.
And get your pet to the vet.
And get your pet to the vet. Exactly.
And then lastly, so I think, Andrew, we talked about if your pet has a wound or some other issue that needs a bandage, we really want to educate pet owners on bandage care because it's such a big thing that you may lose track of. And poor bandage care can actually result in a loss of a limb for your dog.
I've seen it happen.
Yeah, I have too, unfortunately.
Yeah, it's unfortunate.
So, Andrew, you want to give us some bandage care tips?
Yeah, I mean, I think you have to kind of use all your senses when you're looking at bandages. We want you to look at them every day, at least twice a day. And obviously, so you're using your vision. You're looking at it. Is it still intact? Is it falling down? Is it still over the area where it should be over? I know this sounds gross, but you should kind of give it a smell. Give it a sniff. You know, if it smells like infected, like necrotic, you probably know what that smells like.
Cheesy
it should smell
and
really
dead.
bad. Yeah. If you smell something really bad, you got to get that bandage changed. So take it back to the vet immediately. Feel it. You know, feel it if it's moist or if it's damp, if it's wet, if it's soiled. Again, it's got to be changed.
Mm-hmm.
And then finally, if the bandage is in a spot on an extremity, feel the distal extremity, you know, like the toes, or I guess it's really just the toes.
Yeah, and a lot of bandages will leave like 2 toes out, or at least so you can feel the toes and make sure that they're not cold, they're not excessively hot, there's no swelling,
Yeah.
There's no discharge. Any of those things that you see, like, you need to get it right to the vet and have it changed, and follow your vet's directions on when you should bring your dog back in for bandage changes.
Yeah, because the bandages can be too tight. And that actually, I just want to talk quickly about ACE bandages. ACE bandages are very stretchy, and you can put them on too tight.
Yep.
So just make sure that you have the cotton underneath, because the cotton will tear if it gets too tight. So it's sort of a safety mechanism. And then the ACE bandage around it, make sure that you're not stretching it. Make sure you're just pulling it like a normal strength. You're not stretching it so that it's constrictive.
That's a very good point. Yeah, I use that same when I'm putting a bandage on and I'm putting vet wrap on, which is just like an ACE bandage. Yep, exactly. You stretch it out and then you let it go to return to its normal, and then you wrap it.
And it sticks to itself, so you don't really need it to be tight. You just need to be tight enough that it stays on. That's it.
Absolutely. These are all good tips, Andrew. Thank you for bringing this topic up.
Yeah, this was a really fun one to kind of go through and remember all the different aspects of wound care. And it's sort of sad we're ending our hot pet summer series here.
You know, we can always extend hot pet summer.
We can.
Let's
Maybe
talk
we
about
should.
it. Let's talk about it.
Well, we hope you guys have learned something, and we're not done with our podcast. Obviously, we're going to keep coming at you with some new topics. So stay tuned for our next episode. Subscribe and give us a rating, a good rating, hopefully.
5 stars.
5 stars only. Thanks for listening, guys. Cheers.
Cheers.